What's one neurosurgical technical tip you would give to your younger self when you were first starting out? I'll go first. Learn all about ergonomics. Learn how to rest your arms and forearms in surgery so that it reduces tremor, but also improves your tissue handling and makes you look better under the microscope.
Protect your neck and your back as much as you protect your patients. Master head positioning in the operating room. Find ergonomic loops and wear lead that distributes your weight across your whole body. And for women, make sure you're protecting your axilla and your breast tissue from radiation also.
Really enjoy what they're doing right now and don't look to the next step. Don't think your happiness is at when I'm done with residency, I'm a fellow, when I'm a fellow and I'm attending. You need to enjoy what you're doing right now. Make the most out of it immediately. It's not about delayed gratification. It's about today gratification.
The best lessons often happen when your mentor holds the instruments. Be relentlessly self-critical, always better than yesterday. Stay sharp, keep your guard up. Neurosurgery will test you every time you relax.
You did not be overly reliant on advanced technologies such as navigation and robotics, but to really have a firm understanding of the anatomy and the pathology that you're treating. Remember, the sign of a good surgeon, the hallmark of a good surgeon, is being able to bail yourself out of complications and being able to do things in more than one way.
Slow down. You may have heard the saying, slow is smooth and smooth is fast. And I think it's really true. And I think the mistake a lot of younger surgeons make is trying to show how skilled they are by rushing. But often their movements are frantic, undisciplined, sometimes even unsafe. Slow down.
Note to my younger neurosurgical self.
Spend time on your exposure. This is the part of the surgery that is actually the most critical. The more time you spend, the less you will struggle during the surgery, the more efficient your surgery will be, and the better your outcomes. Exposure matters almost as much. Remember, meticulous on the way in, meticulous on the way out.
Get rid of your loops and your headlight. Takanori Fukushima, my mentor and the world-famous late skull-base surgeon, said, headlights are for minors, microscopes are for surgeons. You'll become incredibly gifted at seeing things that other surgeons miss, and you won't have hardware in your neck when you're my age.
When you get into unexpected bleeding, don't always try to stop the bleeding immediately, because often that will make the matter worse and actually increase the bleeding. So at this point, use a hemostatic agent, gentle pressure, and after a little bit of time, that bleeding will routinely stop.
I would teach myself what structures limit my exposure, like a certain nerve, an artery, or a vein, or ligamentous tissue.
Muscle dissection is everything. It predicts how well your patient wakes up. If you carefully dissect the tissue muscle planes, normal planes are the most inviting.
Listen to the voice inside your head, right? The one that tells you you really are a better surgeon than everyone else. Trust that instinct. The younger me, you see the senior residents, you see your attendings, really are better than they are.
And the final tip, always listen to the scrub nurses. They may not necessarily technically have performed the procedures, but believe you me, they're full of pearls of wisdom and they know the procedure inside out, often better than most surgeons. So always listen to the tips and tricks that they give you.